Good morning everyone. Today we are going to talk about hereditary cancers. Inherited cancers constitute around 5 to 10% of all cancer types. These patients have higher than normal risk for certain cancer types, and the predominant pattern of inheritance is autosomal dominant pattern. There are certain clues to hereditary cancer, like occurrence of carcinoma at younger age with a strong family history of malignancies in the family, multiple types of cancer in a single individual, or multiple primary tumors in the same organ. For BRCA1 and BRCA2, there is a strong association with an increased risk for a second breast or ovarian cancer. Strong association between hereditary gastric cancer and lobular breast cancer is due to germline EKDINKARAJA mutation. However, there are few exceptions and challenges in diagnosing a hereditary cancer. Late toxic effects of radiotherapy and chemotherapy will also contribute to the increased risk for a second primary tumor after breast cancer. Thyroid cancer, secondary malignancies of breast, bone, connective tissue and lung are very common after radiotherapy. Incidence of multiple primaries in patients with prostate cancer is approximately 1.14% following radiation therapy and around 4.1 to 16.4% for breast cancer. The classical example for post-radiotherapy is Hodgkin's lymphoma. Survivors of Hodgkin's lymphoma with a history of radiation therapy have an increased risk for breast, lung, thyroid and colorectal cancers. Post-chemotherapy, patients are more prone for secondary leukemias and lung cancer, GI cancers, bladder cancer and soft tissue sarcomas and bone tumors. Post-hormonal therapy. Hormonal treatment of a primary breast cancer increases the risk for endometrial, gastric, colon and ovarian cancers with an excess risk for endometrial cancer, especially after tamoxifen therapy. Environmental factors like UV exposure for melanoma, HPV for cervical cancer, smoking for lung and bladder cancer, smoked fish, canned food for colorectal cancers and bladder cancers. What do I mean by multiple primaries? Multiple primaries are defined as more than one synchronous or metachronous cancer in the same individual. You can see the definition of synchronous and metachronous multiple primaries as per SEER or ISCR and IARC guidelines. So to summarize, the common risk factors for multiple primaries are inherited predisposition to cancer, cancer promoting aspects of lifestyle, hormonal and environmental factors, treatment of the previous primary cancer and increased surveillance of cancer survivors. The incidence of multiple primaries varies in different primary cancer types and treatment that was applied for these cancers. So all these things should be kept in mind before diagnosing a case as hereditary cancer type. Both tumor suppressor genes and oncogenes are responsible for hereditary cancers. Like germline mutations in the tumor suppressor genes contribute to majority of the inherited cancer types. Like BRCA1, BRCA2 for breast, ovarian cancer. We have majority of the inherited cancer types due to germline mutations in tumor suppressor genes. Germline mutations in oncogenes will also contribute to inherited cancers like KIT in familial gist, RUNX1 and ETV6 germline mutations in hematological neoplasms, RET mutation in familial medullary thyroid cancer. So to summarize, reproductive, hormonal and genetic factors as well as obesity are recognized as common risk factors for multiple primaries in female genital tract cancers. Many secondary malignancies are related to smoking in lung cancer. Secondary malignancies can be in lung or in non-lung site like colorectal, bladder, and they are often found as secondary malignancies after a primary lung cancer. Thank you.